Likewise, threat of substitute. What I wonder here is like we don't have to feel the threat of substitute in our product, but I assume that our product will create a threat of substitute for the other product that are existing in the environment. I mean that are existing in the market, because the quality that our product process does not have any other product. Likewise, threat of new entrants, that is quite related to the threat of substitute as well. I mean, it will create a kind of threat for all the products that are existing in the market. I mean, like they can really fear about our product, because our product can displace all those existing products. Likewise, rivalry among existing competitors. Being frank, I think that there will not be any rivals in our market, because this is the only product that we are going to launch in the market, and I assume that it will hold all the 100% shares in the market, because I have never heard about the same product existing in the market. So it has the unique feature, and it will give the investor maximum profit margin. So I strongly recommend you to invest in our product, and you will automatically know the advantage of our product. Thank you. I would like to invite my next friend.
To continue with this, I would like to say the medical device have expanded the ability of physicians to diagnose and to treat the disease. And the researchers have also put their best on the innovations. Moreover, patients expect that the researchers will continue to innovate the cures for aging population. And increasingly, researchers also expect their patients to get more involved, to get more interested and more innovative, to take their decisions about their own health care. So here's the here's the solution, the MediChip net. What is this MediChip net exactly all about? I would like to show you. Okay. Here's the actual MediChip sample. You can pass it. This MediChip, this is the MediChip net, and this MediChip is a collection of the miniaturized test samples. It actually arranged on the solid substrate that permits different tests to be performed all together on the same time. To make it more simple, let's have an example of the computer chip. A computer chip can permit millions of mathematical operations to perform at just in a second. Same way, what MediChip does. MediChip can also perform thousands of biological recreations in just 1 second. So this is what the chip is. Next, this is what the chip looks like. The next is the scanner. This is attached to the scanner. Actually, the chip will be implanted in the human body, so that the scanner can scan the data from the chip, and it can send it to the computer center. It will send 2 computer centers, the one which is attached to the computer, that will be in hospitals or at a specific location, and the one which will have the backup, which will keep the backup data. The next is the data center. The data center is third element of the innovations. It will keep all the backup data, it will store it, so that whenever the technology has any trouble, like any hospitals will be having any technological problems, so that they can directly connect to the data center and they can have the data available there. Okay, so I would like to introduce my MediChip in much more detail. The chip is basically contains 10-digit identification number, which will be scanned by the scanner, which is never duplicated. Once the scanner passed over the chip, it will scan the data and send it to the main computer and the computer data center, so that the computer can analyze the data, can keep the record of the data, and the other data center computer will have the backup recovery of the data. So this is what the chip actually does all about. Moreover, this whole system works on the MediChip implement system. This implement system consists 2 components, the transponder and the reader. The transporter is the actual MediChip and the reader is the actual scanner. This chip system is a radio frequency identification system using the low frequency radio signals to communicate between the chip and the scanner. The reading range between the scanner and the chip will be between 2 and 12 inches. So this is what all about the chip. There are three main concerns which are considered the major. The first is security, second is the backups, and third is the upgrades. What is the security? Everybody has the question about the security, that how secure our data is. What if anyone can get our data? Okay, here's the solution. We would like to welcome all the customers, any patients or any doctors or hospitals or insurance companies who all are concerned with these chips. They all are welcome to register in our system, and they can have we will provide them their own email address and the password, so that even if the scanner scans the data and sends it to the computer, no one can access without having their own email ID, so that whoever is the doctor and treating and diagnoses the patient can only access that data and can have that data, so that the backup data center will have the information about who is the patient, who is the doctor, and who is diagnosis it, what all are the medications, all the backup, all the information will be having with the data centers. The another is the backup. As I said before, that the backup center will be having all the details about the patient. So whenever if any technological problem occur to any hospitals or anywhere else, so that the technology people, they are having the data center and they can send the data immediately to whoever needs it. Okay, I would like to introduce my friend Dr. Fu.
So how do I install this chip into our head? As you see, it's my head. So the wood is just look like this, very, very small. And the process of this surgery is only take 5 minutes, only 5 minutes. And even the patient, he doesn't need to stay in the hospital. Yeah, just 5 minutes. So all the process is done. It's very easy.
There's many costs involved in implementing a gigantic healthcare network of this scale. I'm going to address something. I think you're going to discuss the chip, the data center. I'm basically going to discuss national rollout costs. We're looking at something in the order of billions. I think we're going to have a little more detail, but I think you can see there's the cost of the chips, there's the cost of the scanners, there's the cost of the data center, which at least will be on tap, so it's not, we're paying utility storage there. There's the cost of training a bunch of doctors throughout the country, because this is national rollout. And there's the cost of advertising it to the various interested parties, to the stakeholders. So I think you can see there's a fairly significant cost involved in that. But what we're going to prove to you at the end of this is that despite the high costs, there is an even higher return.